My name is Dr. Lily Muldoon, and I'm an emergency medicine physician in San Francisco.
My name is Sam Hayner, and a month ago I was engineering exhibits in the Science Museum.
My name is Eda Altiak, and I'm a distribution and partnership manager at Get Us PPE.
I can tell you that the stories you are hearing are true. We are facing a national shortage of personal protective equipment. This includes face shields, masks, caps, and gowns, the things that we need to keep our frontline workers safe so they can keep taking care of you. It startles me when I hear stories of my friends, other physicians and nurses who don't have the personal protective equipment they need, and they're getting sick and feeling afraid.
When my friend Lily showed me photos from her friends around the country of the PPE they had, there are things you've probably seen in the news since. A folder divider held up with a scrunchie, a transparency with holes punched out with rubber band. And I knew that we could do better as a stopgap as commodity chains have broken down and this surge in demand arose in this pandemic. So we started working with healthcare workers to see what they needed. We learned about PAPR masks, intubation boxes, face shields, negative pressure hoods. We started working with an array of fabricators and makers around the country, and then people assembling all over from their homes to businesses to medical facilities.
We've been able to successfully link many healthcare facilities around the country with the PPE that they need, but there's still some gaps. One of the gaps is that there's still specialized equipment out there that many of these facilities are not able to get. And there are a lot of smaller facilities out there, like the nursing homes and the community healthcare centers and the hospices, that are not able to get the PPE like the larger facilities. And so that's what we are trying to help with here.
We've so far made 10,000 masks. We've made 1,000 PAPR shields. We've made 12 intubation boxes, and now I've run out of money. And hopefully this is where you come in.
We're trying to help with filling the gap of the specialized equipment and getting PPE like these face shields on the face of healthcare workers at the smaller facilities. So every $5 that you give us gets one of these into one of those smaller facilities, or also helps us develop those specialized equipments.
Thank you. From healthcare workers in San Francisco and from healthcare workers across the United States, we say thank you. Thank you for protecting me so I can keep on taking care of you.